Surgery clinical rotation for 9th semester students of the Faculty of Medicine. The surgery clinical rotation in the 9th semester aims to train medical students in understanding the fundamental principles of surgery, developing procedural skills, and managing patients requiring surgical interventions. Emphasis is placed on mastering theoretical knowledge, technical skills, and a multidisciplinary approach to patient care. 1. Objectives of the surgery clinical rotation. Clinical competencies. Understanding indications and contraindications for surgical interventions. Mastering basic principles of asepsis and antisepsis. Managing preoperative, intraoperative, and postoperative conditions. Procedural competencies. Performing basic surgical procedures under supervision. Assisting and observing major surgeries as a surgical assistant. Communication and collaboration. Communicating with patients and families about the risks and benefits of surgical interventions. Coordinating with multidisciplinary teams, anesthesia, radiology, and other specialties. 2. Learning structure and daily activities. This rotation takes place in various clinical settings, including operating rooms, wards, surgical outpatient clinics, and emergency rooms. A. Ward rounds, activities, assessing postoperative patients, including monitoring vital signs, wound status, and complications. Discussing patient recovery progress and the next steps in management. Objective: integrating theoretical knowledge with clinical conditions of postoperative patients. B. Surgical outpatient clinic. Activities: evaluating outpatients with surgical indications, such as hernias, superficial tumors, or abscesses. Educating patients about upcoming surgical procedures. Objective: understanding the initial assessment, surgical indications, and postoperative follow-up process. C. Emergency room, on-call duty, activities. Managing acute surgical cases such as trauma, fractures, stab wounds, acute appendicitis, or intestinal obstruction. Assisting in resuscitating patients before emergency surgery. Objective: learning triage and initial management steps for surgical emergencies. D. Observation and assistance in surgery. Activities: assisting in major surgeries, such as laparotomy, cholecystectomy, or mastectomy. Performing minor procedures, such as wound suturing, abscess incision and drainage, or superficial biopsies. Objective: understanding operative anatomy and mastering basic surgical techniques. 3. Conditions covered. The rotation includes various conditions requiring surgical intervention, categorized by body systems. A. Digestive surgery. Key diseases: acute appendicitis, preoperative management, appendectomy techniques, and complication management. Inguinal hernia, clinical evaluation and herniaplasty techniques. Acute cholecystitis, conservative approach and laparoscopic cholecystectomy. Skills, abdominal examination, hernia palpation, and interpreting abdominal ultrasound. B. Musculoskeletal system. Key diseases, closed and open fractures, initial management, splinting, reduction, and surgical preparation. Osteomyelitis, clinical diagnosis and surgical debridement planning. Skills, applying casts, simple fracture reduction, and wound suturing in trauma cases. C. Endocrine system, key diseases, thyroid nodules, clinical evaluation and fine needle aspiration biopsy, FNA. Thyroid carcinoma, preoperative preparation for thyroidectomy. Skills, neck examination and interpreting thyroid ultrasonography. D. Urological system, key diseases, kidney stones. Managing acute renal colic and surgical evaluation. Benign prostatic hyperplasia, BPH, conservative management and preparation for TURP, transurethral resection of the prostate. Skills, urinary catheterization and digital rectal examination. E. Surgical oncology, key diseases, breast cancer, clinical evaluation, biopsy, and mastectomy preparation. Skin tumors, excisional biopsy and wound reconstruction techniques. Skills, evaluating superficial nodules and performing excisional biopsies. 4. Clinical procedures mastery. Students are trained to perform basic to advanced procedures under supervision. Basic procedures, wound suturing using simple and complex techniques. Incision and drainage of superficial abscesses. Urinary catheterization. Advanced procedures, under supervision, exploratory laparotomy techniques. Simple fracture reduction and immobilization. Superficial biopsy or fluid aspiration for pathological analysis. 5. Learning methods. A. Surgical simulations. Training in skills laboratories using anatomical models or simulators. Practicing suturing, incisions, and drainage techniques. B. Observation in surgery. Observing major surgical procedures to understand workflows in the operating room. C. Case discussions. Presenting surgical cases to the medical team, including diagnosis, management, and post-operative evaluation. D. Shift duty. Participating in managing emergency surgical cases during night shifts. 6. Assessment. Assessment is conducted based on the following aspects. A. Daily evaluations. Skills in history taking, physical examination, and understanding surgical management principles. Active participation in procedures and surgeries. B. Mini-CEX. Direct assessment of clinical skills, such as wound evaluation and asepsis techniques. C. OSCE. Practical skill exams with simulated surgical procedures. D. Logbook. Daily documentation of patients handled, procedures performed, and surgeries observed. 7. Challenges and opportunities. Challenges. Students often feel anxious during their first surgical experiences. Limited time to independently perform procedures under supervision. Opportunities. Hands-on experience in the operating room enhances understanding of anatomy and surgical techniques. Opportunities to develop technical skills and confidence as future doctors. Conclusion. The surgery clinical rotation provides invaluable experiences in managing cases requiring surgical interventions. Through structured learning, students are trained to become competent in surgical patient management, forming a solid foundation for future medical practice.